The ICF Training and Technical Assistance team is honored to welcome you to this California Housing and Community Development Training session offered through the Emergency Solutions Grant, Coronavirus Relief Consulting and Staffing Services contract. I'm Chris Pitcher from ICF, and I'll be hosting today's session. Today's training session is entitled Racial Equity and Coordinated Entry System, or CES. It is my privilege today to introduce today's first presenter, Alyssa Parrish. Alyssa?
Thanks, Chris. If we can go to the next slide, please. So just a quick welcome to everyone on this wonderful Wednesday. Our agenda for today is we are going to go over welcome and introductions, our learning objectives, some grounding and engagement agreements. We'll go through the coordinate entry system assessment and prioritization processes, a framework for moving forward, incorporating data, and then what's next. So my name is Alyssa Parrish. I'm also part of the ICF team. I use she, her pronouns, and I am Asian. And I'm going to kick it over to Mary Frances.
Hey everyone, great to be in community with you today. My name is Mary Frances Kenyon. I also use she, her pronouns, and I am Black. All right, next up, I am going to switch slides for a moment, but give you a chance first to either whip out your smartphone if you have one and scan the QR code below, or you can join us directly at slido.com and enter 044296. We want to know who's in the room today, and feel free to select all that apply. And the poll is open. All right, so thus far, we're going to leave it open for just a little while longer while folks get acclimated. Again, you can scan the QR code in the upper left-hand corner of your screen or right-hand corner of your screen. Alyssa, can y'all see the Slido screen that I just presented?
Yep, that looks
Okay,
great.
Perfect. It didn't change on my screen. So I was like, left hand or right hand? All right, so it looks like we've got about 15 people that have participated in the poll, and participating organizations are the front runner. We've got some funders, HMIS lead administrator representation, COC leadership, coordinated entry leadership. Just in the interest of time, I'm going to go ahead and move us along. Feel free to continue completing your Slido, and we'll be sure to send the poll results that are final out with all of our materials. All right, Alyssa, I think I'm going to kick it back over to you.
You are, thank you. So for our learning objectives today, engaging and empowering the people most impacted by coordinated entry is really a vital part of this work. And so we're going to spend some time talking about that. I think we are also planning on doing a poll to see if a full session is wanted on this topic around specifically and authentically engaging and partnering with people with lived experience and discussing how to do that in a way that doesn't tokenize or harm folks. So I think we are planning to do that towards the end. We will look at the different data that could be available to you in your community to look at not just the disproportionality of those accessing your coordinated entry, but also then in how the system is serving different subpopulations and intersectionalities of identities, like Black female-headed households with children, for example. We know that most communities may not currently have all the data they may need to fully evaluate their coordinated entry system, especially from an equity perspective. So we're going to look at some additional data and information that you'll want to look for at the local level, which really looks at the contextual qualitative information needed to inform the numbers or the quantitative. So next slide, please. Some grounding. I think we all see the value of coordinated entry, at least in theory. In practice, we know it's hard, and it's even harder to implement in a way that is equitable and really intentionally addresses disparities. Communities did what they needed to do, but I also know that there are still communities that have not fully operationalized coordinated entry. I'm not going to call them out today, either in policy or in practice. And for those who have, evaluating that system that has been built is really an essential part of the process. So while there are 4 key aspects of coordinated entry as defined by the coordinated entry notice, we're really going to focus on assessment and prioritization today because we know that there's some heightened anxiety around these specific pieces with the sunsetting of this thing called the VI SPDAT and the focus on addressing disparities and prioritizing households. We will ask if folks are interested in a separate session around access and referral, which are the other 2 components of coordinated entry. These are also really important to interrogate when we're addressing disparities, but digging into all 4 today was just not realistic unless you wanted to be here with us basically all day. So again, quantitative data really tells us the what or the numbers, and the qualitative really tells us the why around coordinated entry performance. And those put together really help us meaningfully implement effective strategies to address the disparities that we find. So next slide, please. I think I say this at the beginning of all of these trainings, so our engagement expectations, we are naming and just own that virtual webinars are difficult, especially 90-minute ones. We do ask that everyone be here with us. And I think I've also shared this, I really have to intentionally take steps to minimize distractions and multitasking in these virtual settings. So please just, shut down your email, turn over your phone, do whatever you need to do to be here with us and engage. Please use the chat freely. We'd really like to share this space with you as if we're sitting together in a circle and sharing. So feel free to drop in questions as you have them in the chat, and we'll try and get to as many as possible before we wrap up today. So next section, and yes, Taylor did ask, please feel free to take a second to introduce yourself in the chat, share your pronouns, the community you represent, and maybe one word with how you're showing up today. So I think we have our second Slido as well coming up here.
Yep, and I'm going to do the same thing. So you can either, again, go to slido.com and enter the numbers there on your screen, and also, I believe, dropped in the chat, or you can just scan the QR code, and I'm going to share my screen. Here you go. So as soon as we get some folks participating, we'll be able to see where you land on what does your community use for coordinated entry, assessment, and prioritization. And folks are continued. We've got about 20 participants that have completed the poll so far. And I'm instantly curious about something else that just landed on the board. All right. Folks can feel free to continue to participate in the poll. And again, this will be presented with the final materials following today's session. I'm going to switch us back here. All right. Alyssa?
All right. So the COC's written coordinated entry policies and procedures, I think, as we all know, must describe the assessment process, including the documentation of the criteria used for uniform decision-making across access points and intake workers. Training really does need to be provided to all staff administering assessments that clearly describes the methods by which those assessments are to be conducted with fidelity to those written coordinated entry policies and procedures. Assessments are really helpful to capture consistent information about households, but they in and of themselves should not dictate prioritizations. They really help identify housing and service needs that help inform our understanding of any given household's level of vulnerability. And we'll talk through vulnerability a little bit more later too. All tools and processes used for the purposes of coordinated entry really need to be carefully considered within the context of your community's needs, priorities, the specific households you serve, and housing stock. And there's going to be more on this in a couple of slides as well. So next slide, and I'm gonna say it, I'm gonna say the VI SPDAT. So in a message from ORCODE on January 25th, 2021, they stated that the VI SPDAT was never intended to address racial and gender inequities. It also reminds us all that the VI SPDAT was never designed to be an assessment tool. It was designed as a triage tool, and assessment should follow whatever results come from the VI SPDAT. What happened though is that communities across the country really began to use it, and instead of using it as a triage tool, followed by a comprehensive assessment that was empowering, strengths-based, trauma-informed, and culturally humble, they stopped with the VI SPDAT. So this happened across the country, right? In communities of all shapes, sizes, compositions. I think those words standardized and validated are really intimidating words. And since the VI SPDAT claimed to be both, communities really gravitated towards it. In October 2019, C4 issued a report based on 3 communities utilizing the VI SPDAT to prioritize households through their coordinated entry processes. The report showed ways in which the VI SPDAT creates inequitable outcomes for households of color, and consistently showed that white households, both single adults and families with children, score higher on the VI SPDAT than households of color, which means that white households are consistently prioritized for PSH at a higher rate than households of color, which we are still seeing in the data today across the country. This does not automatically mean that white households are more vulnerable than households of color. It really means that interrogation of the data show that there are other reasons why white households are scoring higher on the VI SPDAT, including who is administering the SPDAT with the household, the subscales and questions included in the tool, and the tool not incorporating cultural relevance. So I think we all know that ORCODE has announced that they will stop supporting the VI SPDAT, and communities are really looking at other options, which is one of the many reasons why we're here talking with you. So next slide. So those big terms, standardized, validated, a tool, are all really researchy, data-y words, and really influenced how communities interpreted the CPD notice around coordinated entry. Because the VI SPDAT claimed to be standardized and validated, communities really believed it met the requirement. The CPD notice also uses the term approaches. The assessment approach should be locally standardized and locally validated. This really means that the community has done its due diligence to ensure that any assessment approach used for the purposes of coordinated entry at the local level is consistently applied across access points. It also means that the community has done its due diligence to ensure that the assessment approach is relevant to the households it serves at the local level, so that it is truly measuring for vulnerability. Some COCs have developed their own assessment approaches, including a tool. This is because the COC's probability of success with the assessment element of coordinated entry really improves when locally specific assessment approaches are used. And they're also more likely to address racial disparities when locally validated, because racial inequity in Anchorage, Alaska looks very different than racial inequity in San Diego, California. So we also want to touch on the term evidence-based, which also feels really big and researchy. This really just means that there's evidence at the local level that the particular characteristic or situation you are assessing for has been shown to increase someone's risk of homelessness. We're going to look closer at indicators for assessing a little bit later, but at a high level, these can and should be locally relevant, and engaging people with lived experience and people of color in understanding these is really necessary and vital. So that last slide may have made it seem like I was bashing heavily on the VI SPDAT, but I'm really not. This is not just about the VI SPDAT. It's about any off-the-shelf tool that a community has not tested within their local context to determine if it is relevant for the households they serve. It also really speaks to something broader about using a tool that generates a score to try and measure vulnerability, which is a very human trait. There are other pieces of information that can and should be incorporated into the coordinated entry assessment and prioritization processes to determine vulnerability, which again, we're going to touch on a little bit more later. I've heard a lot of communities ask what tool is other communities using, or we just want to know what to use. I'm going to say right now that this won't be a simple process. We do not want to see communities replace one tool with some other off-the-shelf tool that has no or limited local relevance. We really want communities to think about the overall approach and process, of which a tool may be one component, and any tool that is used has been locally defined and contextualized. So this is this is an intentional process and won't be something that we're just going to replace overnight. So next slide, in summary here, access, assessment, prioritization, and referral are still our key components of coordinated entry. Today, we're really focused on assessment and prioritization. Again, if folks are interested in a session specifically on access and referral, which are also really important to ensuring equitable outcomes in coordinated entry, please let us know in the chat. We've also seen too much focus on the tool part of coordinated entry rather than a process or approach. And moving forward, we really want to work with communities on their overall process, not in finding another tool. And that's because we really know that replacing one tool with another tool won't make things better and may even exacerbate already existing inequities. Promise that all of this is allowable, and it still ensures communities meet the regulatory requirements of coordinated entry while ensuring the process is locally relevant and best meets the needs of the households that it serves. So I think we're going to kick it over to Mary Frances now.
Thanks, Alyssa. And of course, I just have one little tidbit to add on. When we're talking about coordinated entry, and I know that Alyssa did a beautiful job talking through the assessment tool piece and where some of those challenges are. As we begin to dive into sort of a framework for moving forward, I just want to name for everyone that a huge part of the problem with coordinated entry has to do with upstream systems, serving as feeder systems into homelessness. We've covered this in other trainings that we've done with you all, but I can't emphasize that enough. We will see a plateau of the ability to reduce disparities in homelessness if we don't break down silos and don't make deeper connections to the different parts of the justice system and the child welfare system and the education system. This is not work that can be done in a vacuum, and this is not work that can be done resting on the shoulders of just the homelessness response system. So with that caveat, we want to talk about how you can develop a strategy to pursue equity. There was a study that just came out. We were doing some work for another state, and one of the findings that we made was, again, communities are starting to plateau in their ability to reduce racial disparities because there's been such a heavy focus on data and not enough focus on shifting power, right? So the first step here in your strategy is going to be to disrupt existing decision-making structures. And you can think about decision-making structures as those that are the decision makers, those that have influence over the decision makers, and then those groups that are historically minoritized and excluded that are below the radar. They don't have a voice, they don't have a seat at the table, and they are sort of 2 layers removed in that power structure that lies within your system. So as you are moving forward, that's like first stop, right? The second piece is focusing on community goals. And Alyssa just spent a lot of time talking about how we should be localizing any sort of assessment tool or process so that it meets the community needs. You also want to do that same process with your community goals. Embracing an iterative process, like it's okay to make mistakes along the way. That is an expectation. A lot of the work that we're doing in pursuit of equity is, a lot of the work that we're doing in pursuit has never been done before. And there's not necessarily a precedent on how to develop goals, implement strategies, and then test that it's actually working. So as a part of your sort of continuous quality improvement, you're going to have iteration. You're going to have strategies that might miss the mark a little bit and need to be reconfigured so that you can achieve the goals that you're setting out to achieve within your community. Incorporating housing problem solving. This is near and dear to my heart. When you think about housing problem solving, and there's some great newer-ish resources out on the HUD Exchange if you're interested, housing problem solving is not tied to the historically marginalizing practices and project types that we've had in the homeless response system. This concept of problem solving is really coming from a strengths-based approach. It is being in conversation with people that are experiencing a housing crisis or homelessness, as opposed to prescribing to them what their intervention will look like. You don't need an assessment tool in order to have a housing problem solving conversation with someone, and it doesn't necessarily have to be confined as a strategy to just coordinated entry, right? So you can have it at different points in your coordinated entry system, whether that be prevention, diversion. You can also have it on the back end, right, through something we call rapid exit. So identifying folks that just need a little light touch case management, a little financial assistance, to help them quickly exit homelessness, right? So really, really great conversation. Just quick community example, when we implemented this in one of the communities I worked in, we were able to eliminate shelter waiting lists. We were able to reduce our inflow. We were also able to prioritize those individuals that needed shelter most, had no resources, no natural supports, and no other options, and they'd otherwise be on the street. But for that opportunity to access emergency shelter. When you reduce your inflow and increase your outflow in a system, something beautiful happens, and that's called reducing the amount of people experiencing homelessness in your system. So a really powerful strategy that you can use and implement in your community. Next step in developing your strategy, you want to leverage data. Alyssa will always say this. I will always say this. When we talk about data, we're not just talking about the numbers. We are also talking about the humans behind those numbers, because if you are not improving the human experience in your coordinated entry system, you have a problem that you need to fix, and you need to fix quickly. And I say that in the most loving and caring way. Yes, we want to end homelessness for people. We want to prevent it wherever we can, but we also want to remember that these are someone's brother, sister, mom, uncle, cousin, friend, coworker that have real human feelings and need to have a very respectable, responsive, culturally responsive experience as they're navigating the different steps in coordinated entry. Finally, you're going to execute the change. And after you execute the change, similar to that iterative process, you want to test it, right? You want to make sure that it's working, and not just working for one group of people, but working for all people, right? You want to also update it. I know, and I'm just speaking for myself here, but I know when we first, stepped into compliance with our coordinated entry policies and procedures, we didn't go back to touch that thing until many years later. And that's not what you want to do, right? You want your strategies to be living and breathing and adaptable, so that you can continue to make informed changes to the process and ensure that you are creating a more positive human experience for people, in addition to helping them exit your system as quickly as possible, so that they're not in crisis, so that they're not unsheltered, so that they're not experiencing homelessness. So as we talk about each of these steps in greater detail, when we're talking about decision-making structures, we can say decision-making structures, but we're really talking about power sharing, right? So when you're looking at your current structures, we're talking about who built the table, who has a seat at the table, Who holds the power and how can it be equitable? If you are serving a community that is largely represented by folks that identify as Black, folks that identify as Native Hawaiian Pacific Islander, and you don't see that representation at your decision-making tables, you need to interrogate why that is. You need to do some research, and you're going to want to figure out what has precluded representation of the people who are being most impacted by decisions being made around the table. You also want to do a level of empowerment, meeting frequently, not just meeting frequently, but making sure that meetings are accessible, making sure that meetings are, there's an agenda in advance. People know how to access the meeting. Is it an in-person meeting? Is it a virtual meeting? Is there enough capacity to support large bodies of people? Making sure that folks that are around that decision-making table know that, yes, they do have the authority to make these decisions and to move strategies forward, but you've got to balance that with making sure, again, that you've got the right mixture of people around the table, and that group is representative of the folks experiencing homelessness in your community. I'm going to want us to get out of sort of the black and white binary. Think big, right? Think beyond race, think beyond ethnicity. If you have a high volume of people in your communities that are part of the aging population, they might need to have a seat at the table. If you've got a large chunk of people who, happen to have disabilities, they need a seat at the table. And that's throughout all the spectrum of the different sort of protected classes. But you want your decision-making tables to be really fully representative of those that are experiencing homelessness. Also, incorporating voices of people who have lived experience is equally, if not more important, to have folks around the table. And we'll spend some time talking about what meaningful and authentic engagement is. I like to describe it as this. It's my elevator pitch. We're not suggesting that you give people a token of appreciation for their time spent. If they have lived experience, we're asking for full and fair compensation, meaning in my former service provider hat, if I was around a table and in 15 different COC meetings per quarter, I get compensated for that. I accrue leave, I get, pay with fringe benefits, bless you, Alyssa. And I also, I am prepared to go into these meetings. We need to be doing the same exact thing for people with lived experience. We cannot invite them to the table and not compensate them fairly and equitably. So think total compensation, think not just monetary pay. Token of appreciation as a gift card. We're not asking for gift cards, although that's a starting point for many communities that you can build towards actual monetary compensation. We're talking about transportation assistance. We're talking about food. We're talking about Wi-Fi access or devices. And there are avenues that you can take as a community to secure sort of the total compensation package to make sure that we are meaningfully and authentically engaging people with lived experience. So I've already kind of given this away because I get a little passionate about it, but can't stress enough how critical this is to any strategy that's going to be in pursuit of equity. We have to model the equity that we're trying to achieve in communities, right? And the way that we do that is by making sure that people who happen to have lived experience of homelessness or housing insecurity are represented at the decision-making tables because they are the experts in your systems, right? They're the experts in your systems. What you want to do is engage them at all levels of planning and implementation. You also want to address those barriers to participation. I'm going to give you a very clear example of a barrier to participation. Having a standing meeting on the third Monday of every month at 10 a.m., right? Already you've excluded people that might otherwise be willing to and wanting to participate in your meetings. So what we've got to do is think about having weekend meetings, think about having evening meetings, and thinking about having those meetings outside of your normal traditional government structures or service provider structures. What that means is you might need to reach out to one of your affordable housing partners in the community and ask if they have a community room so that you can host a meeting right in the community that's accessible, whether it's by public transportation or walking distance, but you want to bring the meeting to the people that need to be in attendance most. You're not encouraged to continue with the status quo when it comes to engagement. So how do you create transformational versus transactional relationships, which is a really sort of a foundational step? You've got to have the support and capacity, right? You've got to be able to meet people where they are. I love to give examples. I'm an example giver, but I can recall as I was working on building out our lived experience council, like I had to, we had to pack it up and go meet people in their homes because someone had a disability and they couldn't get around, right? We had to meet them in the community. Right. We also had to help them navigate how to get transportation requests through Medicare, which is not fun, by the way, but it's necessary. You have to be willing to go that extra mile to support people, meet them where they are, and welcome them into your decision-making structure. Be aware of tokenizing and decorative engagement. I'm going to say this, and I might take some slack for saying this. But don't put people with lived experience on a dog and pony show. They happen to have lived experience of homelessness or housing insecurity, but that does not define them. That does not disregard all of the other attributes and strengths that they bring to the table that you may be wholly unaware of, right? So don't do the dog and pony show, but also they can do more than just tell their story, right? Like, let's not re-traumatize people by having them have to relive their story in front of audiences so that you can check a box. That's not what we're asking for here. What we're asking for, again, is that meaningful and authentic engagement. Also, you're going to have to re-envision the white dominant culture norms that often show up in our spaces. We're talking about expertise, right? We're talking about professionalism standards, right? It's not up to us to tone police. It's not up to us to dictate the ways in which other people show up and how they vocalize their passion or their frustration. So you're going to have to do some work on that. Also, as you're working towards shifting power and providing the supports, you want to be sure that you're looking at supports in a holistic view, meaning you want to ensure that you're not doing a blanket approach, because every person with lived experience might not have the same needs and probably doesn't have the same needs. You might have someone that might need childcare in order to be present as a decision maker at your table versus someone that doesn't really need any supports and declines to have a stipend or a payment for their participation. That's okay. We're not looking for a blanket approach to engagement. We're looking for that more transformational type of relationship that's really person-centered. The same way that we would have an expectation that like housing-focused case management is provided and tailored to an individual, tailored to a head of household, you want to do that with your relationship building, right? This is not applying a broad standard for every single person who has lived experience, because they are not a monolith. And if you want to talk more about this, we could spend a long time talking about this. You can let us know, just drop a note in the chat and we can work on making that happen. So as you are shifting towards your focus on community goals, you want to keep the work centered on broader community goals that are locally defined and contextualized. So when you're talking from a coordinated entry lens about vulnerability, what does that actually mean in your community? Does vulnerability mean those who are unsheltered? Does vulnerability mean those who have had ACEs or adverse childhood experiences? Are you factoring in social determinants of health? You want to really define at the community level what these things mean to you and your community. And again, got to have folks with lived experience in informing what vulnerability actually looks like across a broader set of people, not just one person, right? That's tokenizing. You want to have broader participation. And when you're prioritizing to maximize equity, how is equitable defined locally? Like, what does that look like? Are we looking at racial equity? Are we looking at equity for the LGBTQ community? Are we looking at equity, from the lens of race and disability? What does it mean to each of you at the community level? Iterative process. You will see an acronym up here, SMART T goals. I think all of us are familiar with SMART goals. When we talk about SMART goals, that's great, but we want to go a step further, and we want to make sure that the goals being established are inclusive and equitable, right? So the SMART T is just to remember that you shouldn't be developing SMART goals that don't have anything centered around inclusion and equity. Again, it's an iterative process and you want to learn. It's okay to make mistakes, but you've got to do some ongoing monitoring and evaluation. You want to revisit the process often, and then you make those tweaks to your process as you go along. Some things may need to be enhanced. Some things may be causing harm, and you've got to eliminate them from your process altogether. That's okay. You acknowledge, hey, this is causing harm. We did not intend to cause this harm, but we need to eliminate this immediately. I think the days of knowing that we're causing harm in our systems should be long gone. So this is a really important step in the process. And then also trust the process. You do have to, as long as you're not causing immediate harm, you do have to give it a chance to see if you're going to be successful. And again, as a part of this sort of monitoring and evaluation in this iterative process, you're not just focused on the numbers, you're not focused solely on the quantitative data, but you want to know about the human experience. Is the human experience being positively impacted, or is it being negatively impacted? This should always be a consideration as you are iterating. And then I've already said this because I get real hyped up about housing problem solving. That's kind of my jam. Again, it's just as a philosophy and approach, it's not rooted in any historically marginalizing practices. And it's really more of a fundamental approach for everyone that is not contingent upon the same standardized assessment used for other housing resources, used for screening, eligibility, or prioritization. And most often, housing problem solving ends up just being a conversation and a resource referral and helping people navigate through their crisis in that moment. So I share that to say that adopting housing problem solving techniques system-wide is a really critical strategy for building and strengthening a diverse array of resources that you need in order to prevent housing loss and also help people exit homelessness. So, again, in the gist of it, housing problem solving is a conversation with people to identify safer alternatives. It taps into some creative thinking and pursuing different options. And it's also providing us with an opportunity to do more with less. And we can talk about this later, but if you establish this system-wide, remember I mentioned a little bit earlier, diversion prevention, rapid exit. This can be the first phase of the assessment process, but it doesn't have to, like, just because you have one problem-solving conversation doesn't mean that you stop having them. All right, leveraging data.
All right, I think that is me. So we have a lot of data available to us, but we don't always use it well or at all. And in the worst cases, we misuse it. So we do want to make sure that we leverage the data that we have to really improve the performance of our system. so that we can equitably and effectively serve the households who are most vulnerable in our community, because that's the ultimate goal, right? We really want to mobilize our data and interrogate the data we have to understand how accurate and reliable the data is today, and then how changes to the assessment process could impact equity, efficiency, and effectiveness tomorrow. We also really want to implement processes that will address any inaccuracy or unreliability we find in this process. And we want to look at the various decision points throughout coordinated entry and disaggregate that data by race, ethnicity, gender, household type, age, and other identities to really understand the system performance. So how long are households on our prioritization list, who's getting referred, who's falling out of the process before they can get referred and why, where are they going, where are the folks going when they leave the system, who is getting housed and with what project types, how long are they staying in that housing, where are they exiting to from that housing, and then ultimately who is returning to our system and after how long. And again, I think we've emphasized this a couple of different times today, but we can't just look at the numbers. We also need to understand the context behind the numbers. So as an example, we could find that American Indian and Alaska Native households are getting referred to housing supports at a proportionate rate to their accessing coordinated entry. But then the time between being referred and being housed is significantly longer than the overall average. And without talking with people to understand why this is happening, we can't create effective strategies to address this. So next slide is all about executing change and just naming that this is hard, like capital H-A-R-D, hard. It won't be easy because change in and of itself isn't easy, but it is so worthwhile. There is some guidance on the HUD exchange that can help communities simplify this process. So we've got the COVID coordinated entry guidance as an example, linked in the slide deck, which you will have access to after today. We also really need to manage expectations up front for ourselves, for the community, for the people that we're serving, because this isn't going to happen overnight. We really need to expect that this will take time and we also need to expect that this will probably unearth things about our system, maybe even ourselves, that we didn't know and might be a little bit uncomfortable with. So we need to test questions and processes to really ensure that they are relevant at the local level and truly measure vulnerability for the households your community serves. And if they don't do what was anticipated, then we can change them. I think we've also mentioned, and Mary really did a wonderful job with this, but we do need to ensure that the voices of those who are most impacted by coordinated entry stay front and center throughout this process. If they say something doesn't feel right or isn't doing what was intended, we don't want to just hear them. We really need to listen and pivot. Also, Mary emphasized housing problem solving, as was discussed earlier, is really powerful when it's meaningfully incorporated throughout your entire homeless response system as a philosophy. So CQI, continuous quality improvement. Do you remember your first cell phone? Mine was a Nokia with voice stream service. That is not the cell phone I have now. And it was slightly disruptive each time I've had to change cell phones over the years, but each upgrade was really necessary. So let's think of coordinated entry in the same way. We've upgraded over time and it will feel slightly disruptive in the beginning, but it will be worth it. And then you will monitor it over time by checking how quickly the battery dies, how full your memory is, how many cracks in the screen there are, to really determine when another change is necessary. We need to have performance indicators like this for our coordinated entry to determine when pivots and changes are necessary. We also really need to ensure that the changes we implement actually do what was intended and don't exacerbate already existing disparities. So if you find the changes are not creating the intended outcomes, we can pivot and shift. And again, the voices of those most impacted by coordinated entry must be involved in this process at every step along the way, and we really need to listen to them. And I think I'm throwing it back to Mary.
Yeah, I'm sorry. I'm sorry, I was getting wrapped up in the chat. And I promise for those couple of folks that had questions for me, I will respond as soon as Alyssa takes over the next set of slides. But for now, we're going to move into incorporating data, right? So taking that data, turning it into knowledge, and then action. So there are some indicators for assessing and prioritizing. Think back to just a moment ago when we talked about vulnerability and defining what that actually means at the community level. You're going to look at service needs, barriers, and lack of supports. And last, but of course not least, strengths. In everything we do, we want to be doing or using a strengths-based approach. So there are some indicators for vulnerability. This is not fully inclusive and it may look different depending on the community you're in. But some indicators of vulnerability include living in an unsheltered situation, especially for youth and children. History of victimization, right? And that runs a full gamut of victimization while experiencing homelessness, whether that be assault, trafficking, sex work, etc. That prior interaction with the foster care system or juvenile justice system as a child or a young person. Also adverse childhood experiences, so those childhood traumas that may come up, and social determinants of health. What about folks? Can you use the chat to talk about some of your indicators of vulnerabilities in the chat? Beyond what's up here? And while you guys get rolling with dropping your indicators for vulnerability, there we go. Frequent users of the emergency department, justice involvement. Thanks, Shannon, Emily, veterans. Yes. Keep them coming. We're going to move along. Indicators for service needs, and you can sort of follow the same system here. We're going to ask what else, but here are some indicators for service needs. So activities of daily living, that's a big one. Folks not being able to complete those ADLs often are an indicator of service needs. History or record of heavy healthcare use. So I think we had a respondent actually put that in the chat there. History or record of hospitalizations or inpatient respite treatment, whether that's psychiatric, substance use, etc. Thank you, Joe. I see that SUD in there. Also, the inability to maintain housing on one's own, right? Paying bills or rent, maintaining physical space. What else do you have? I'm seeing ACEs coming up from Joe. Elizabeth's got regular food pantry visitors, right? That's an indicator of food insecurity. You can keep multiple disabling conditions. You can keep rolling in the chat. Let's talk about some indicators for housing barriers. So there's a range here that goes the gamut of lack of leaseholding history, history of evictions, violent, drug-related, or sex offense history, because we know that it's near impossible to get folks with that in their background into housing. General criminal history, lack of employment history or current employment, bad credit history. What else do you all see as housing barriers? That is a great question that Joe just asked. What about individuals that fear seeking services? I think that's incredibly legitimate and valid. You have specific groups that may be fearful or distrusting of the government. Lack of childcare resources. Yes, that resonates. I'm coming off of a 4-year daycare bill for twin boys. So family trauma, racism, hoarding. Thank you, Carrie. That's one that we don't often talk about. Hoarding can be a huge problem for maintaining housing. Physical appearance, lack of affordable housing. All right, let's talk about strengths, right? We know that each individual, regardless of their circumstances, comes to us with a set of strengths. I want you all just to drop in the chat, what type of strengths do you all see? Like, what can be leveraged to assist folks in a crisis? And how can you use those strengths to offset maybe some of those risk factors that folks are presenting to you with? Resilience, yes. Resilience and flexibility. Thank you, Emily. What about others? And we have some broader buckets of categories here, ranging from family to community to cultural to individual. Yes, Noah. Individuals and families experiencing homelessness are some of the most innovative people on the planet. Lived experience and knowledge. Pets, yes, and I hope that your shelter systems allow pets. Intelligence, past experience and skills, a desire for support, determination, existing support systems. Excellent. All right, you can keep chatting here. We're going to move on to some coordinated entry system data and prioritization. So similar to what we've shared in other trainings, when it comes down to looking at your data and really interrogating that data, you want to do a disaggregation, right? Wherever possible. I'm hoping that you're able to do this with your existing data sets and systems. You want to take a look at your data, your coordinated entry data, and break it down by race and ethnicity and gender and age and disabling condition and household type across each domain that is available. You want to know who's on your prioritization, who's been referred, who's been housed, who's falling out, like who's falling below the radar. Who is it that keeps coming back to your system? They get assessed and then you get referred and then they don't get housed, but they show up later. And how long is each phase of coordinated entry taking? Then think about that. I think it was either Joe or Noah that put this in the chat earlier. But what about those folks that are afraid to come to your coordinated entry system access point? Who's not accessing it and why is that? You need to interrogate why that's happening. I think we spend a lot of time focusing on disparities and overrepresentation in homelessness, but we spend far too little time looking at those pan-ethnic umbrellas, those pan-ethnic identifiers that couch a whole, multiple groups of people under one domain. And what happens there is that you might miss some really, really deep disparities. Then you want to look at whether or not the prioritization process is assessing for vulnerability. Like, is it actually assessing for vulnerability the way that you've defined it at a community level? And then how is your coordinated entry system functioning relative to those goals and priorities? Again, Alyssa and I spend a lot of time talking about data, but not just the numbers. We talk about the people. There's a reason for that. There are some great tools that are at your fingertips. Maybe some more than others, but that shouldn't prevent you. Whether you have access to one of these or all of these, there are different ways that you can get qualitative data. You can do one-on-one interviews. You can do focus groups. You can do case study research. You can do process of observation. You can look at record keeping. Look at your case notes. Those are invaluable, right? Ethnographic research as well, but also surveys. Quick example, want to be mindful of time, but one of the things we did in my community that I will continuously reference is Arlington County, Virginia. That's where I spent 6 years prior to transitioning into being a TA provider. And in that community, we, for our providers, when we're doing the COC program in OFA, we embedded a requirement for them to survey people on a quarterly basis. Shelter systems, permanent supportive housing, rapid rehousing, and other permanent housing projects that we had. And we got some incredibly valuable information by way of those surveys, particularly around limited English proficiency and how poorly we were doing with meeting the language needs of people experiencing homelessness. So surveys are sometimes not popular, but it's a really great way to get some insight from your different programs around what's working and what's not. Feel free to continue to drop other areas in the chat. And thank you, Alejandra, for uplifting that race options should be clearly explained to participants and clients so that they have the opportunity to self-select. Qualitative data continued. So again, you've heard Alyssa and I talk a lot about human experience. That is what qualitative data gets us. It speaks to the human experience. So, the analysis that you perform is limited in value if it only uses the numbers. You've got to have the experiences behind those numbers. And Alyssa is famous for saying that quantitative data can highlight an inequity, the what, but it doesn't explain the why in relationship to why the inequity exists. Next up, just want to kind of close us out before we move on to the next chapter, and I hand it back over to Alyssa. We want to continue. This is going to be our recurring theme for forever and always. People most impacted by coordinated entry need to be involved in every step of the decision-making process, implementation, revisions to policy. It's a lot of work, but I promise you the end result will be worth it. I think Austin, Texas is a recent example of what that looks like when the folks most impacted are centered in the work. Local context matters, standardized and validated at the local level, right? For your assessment process, an assessment tool. And this isn't the last iteration. You need to plan to continue to refine, to continue to improve, and to also pivot as needed. Definitely use the data that you have and determine what indicators are valuable at the local level. And you want to look at not just who is accessing coordinated entry, but how they're being served. And final point here is incorporating qualitative data. It is just as critically important as the numbers are and give you a fuller picture. Melissa?
All right, so what's next? Communities really can develop their own assessment and prioritization processes if we haven't been clear about that today. So I'm just putting that out there as clearly as we can. And if not fully create or develop them, they should absolutely make sure that anything that is used is locally tested and validated to really measure vulnerability with the households your specific community serves. Housing problem solving, again, is really a great opportunity to serve more households and do so with a trauma-informed, culturally humble approach. And we will continue to emphasize the absolute need to incorporate the voices of those most impacted by the coordinated entry system into every step of the process. We do need to empower them to be decision makers in this process, not tokenize or bring them into the process for performative purposes, and make sure that we support them to success. Their voices really do need to be listened to and incorporated into any decisions we make. We know that the people we see in our homeless response systems are whole people. So as Mary mentioned and emphasized earlier, they are not their homelessness. They experienced a situation and they bring a lot of other traits and skills and resources to the table with them, just like all the rest of us. And partnering with other systems of care across the community, as we've had to do over the last, I guess we're going on 2 years now, will remain an essential function to ensure we serve households holistically. One of the lessons that we learned from communities that have worked to re-envision their coordinated entry process has been that the team that works on this is really one of the most important pieces. So the team does need to be diverse, inclusive, and represent the population being served, incorporate various perspectives, and bring in folks who are not traditionally at the table. Another lesson that we've learned with communities is that even with a strong team, the magic, which is really the trust, doesn't just happen. We need to create opportunities for folks to connect outside of those transactional functions and make opportunities for transformative relationships. So make space at the beginning of meetings to discuss life, because in the same way that the people we serve are not just their homelessness, we are not just the work we do. We are whole people who have been impacted by a global pandemic over the last 2 years, and we have many aspects of ourselves that we bring to the work. Work towards a shared vision for how to move forward and address disparities, and then level set those expectations and meet folks where they are. This equity versus equality, even for members of the team. So building the trust among team members, this idea of like building relationships versus simple transactions. The previous slide had a picture of the Avengers on it. And like one of the best parts about those movies is they're not just involved in these transactional relationships. They take time to understand each other and learn from each other and learn about themselves. They're modeling vulnerability and authenticity. And we're really taking time in the beginning to create a culture for the team. Sometimes this feels a little squishy, but I've been involved in those processes with various teams where we step back and take time to really learn about each other outside of our work settings, create a culture for the team, and it makes a world of difference. We're more effective, we're more efficient, we do work more authentically. And I think also naming where you feel uncomfortable is really important, and knowing what that looks like for yourself as well, and asking to be held accountable. We establish engagement expectations at the beginning of each of these trainings, but I think also just as important, and I think Mary's got a link that if you can find it quickly, you can drop in around establishing group agreements, why that's important and why that the co-creation of those agreements up front so that the team creates a safe space for all is really important. So we've talked a lot about how data can be used to help interrogate your coordinated entry system. I think I mentioned earlier that the worst case scenario of data is when it is misused. This has happened and it has caused harm to households intentionally or otherwise. I think the only reason, and I think I've mentioned this before too, the only reason I'm a data nerd about HMIS is because I know that every single data point in HMIS is meant to represent a person that we are trying to serve in our systems. We cannot lose sight of that. These aren't just numbers. These are numbers that represent folks who are in crisis, who are hurting, and who we are trying to serve equitably and effectively. So we need to make sure that we use the data in a way that does not cause harm. And as a data person, I can say that we sometimes get really excited about our findings and we want to make assumptions, but we can't. We really need to pause and look at all the factors that feed into that data. We aren't talking about data-driven decision-making. What we're really focused on is data-informed decision-making. Our data can help better inform our decisions, processes, and strategies, but it shouldn't be driving them. Again, quantitative and numbers really tells us what the disparities are, and the qualitative information tells us why those disparities exist. We need both to create effective strategies to address the disparities, and that local context really matters.
So one of the things that often comes up in communities is around annual training needs. I've worked in a lot of different communities throughout the country and often find that they're like, training, what do you mean training? We have to do this training thing every year. And I'm like, yes, absolutely. Training is like a part of a continuous quality improvement cycle for your entire system. And there are many different types of trainings. You can go beyond what you see on this list. But there are some really great trainings that should be like a part of every COC, in my opinion. Culturally sensitive trauma-informed care is one, human-centered engagement, prioritizing program participant choice. That's something that I find a lot of folks struggle with in this space, allowing people to be the drivers of what their choices are. Housing problem solving is great. Cultural humility and anti-racism. I want to just say a quick word on cultural humility. Many folks have probably received or heard of some type of cultural competency training. we would be remiss if we thought that as individual humans that we could be competent in other people's culture that we're not from, because cultures like races, ethnicities, they're not monolithic, right? What one person subscribes to may not be representative of other people and cultures. Equal access, this is a big one. Making sure that there's annual training provided around the equal access provisions. Emergency transfer plan policies. For some reason, we tend to think of domestic and sexual violence as sitting like on an island outside of the homeless response system, when in actuality, people that have survived domestic violence or domestic or sexual violence are in fact experiencing homelessness. So you really want to make sure that folks in your COC are in tune with the emergency transfer plan policies that you have in place. Conversational case management, motivational interviewing and strengths-based approaches, racial equity. All of you are here with us, and hopefully many of you will continue on as we have smaller cohorts of training. Last but not least, fair housing. Most state agencies have like a dedicated department that will go out into the community and do fair housing trainings for large groups of people. You want to make sure that you have fair housing training. We love this infographic here. We can do hard things. Like, we can do this. It's not easy. It's really difficult to undo systemic structures that have been put into place, right? But it's time to rip off the Band-Aid and make some changes. You can work towards equitable approaches to coordinated entry assessment and prioritization. And as you go through this work, it's going to be hard. It's going to be difficult. It's going to require time. It's going to require resources. And you're going to develop some personal insights about yourself and where your biases might lie. And it's also imperative that we move away from this tool-based system that really hasn't achieved what a community needs. We're trying to move towards a system that will allow us for equity in outcomes, but also in process. In summary, before we move on to our next Slido, your team is going to be critical in this process. You got to have trust within the team in order to do this work. Using data with mindfulness, right? Remembering that in some instances, data has been widely used to cause harm to people. So you've got to be responsible. Don't assume, interrogate, question, push back, dig deeper. Last but not least, this work is really hard, but it's really necessary because people's lives depend on it, right? So with that, I'm going to ask you to participate in our final poll of the day. And I've got it up here. You can join us here. Just type in one word or phrase after today's session. You can scan the QR code, or you can go to slido.com and enter 044296. And I promise neither myself nor Alyssa will have hurt feelings. We genuinely review all of this information to figure out ways that we can improve, right? The same way we're asking each of you to do some continuous quality improvement, we do the same. So feel free to use candor. All right, and keep going. I'm gonna take down this screen because I believe we are ahead of schedule. And we've got some time for a little bit of Q&A, I believe. Chris, is that right?
That is 100% right, Mary Frances. Thank you for that presentation, and Alyssa as well. We are well ahead of schedule, so we want to use this time to have some dialogue. So I'll just go ahead and set this up before we go to slide 46, which you can move to now, Mary Frances, if you'd like. I'm going to start with a few things that we have addressed in the chat that I just want to address verbally. There have been a few asks about what's the rest of our racial equity trainings look like for the rest of this year. The answer is we don't have them completely fleshed out. This is the last one we have scheduled. We are working on getting a data coordinate entry and data second session going. We do have everything kind of mapped out. We just don't have dates, times, locations, all that stuff. So do be on the lookout for that in the coming weeks, a schedule for the rest of the trainings on racial equity. The recording of today's session, the materials from today's session will be sent out to all attendees via email, and will ultimately be posted on the website that I've put in the chat a few times, which I'll put in there one more time, in a few weeks. We do have to take all these materials, the recordings on the materials, to go through the 508 compliance process, get them loaded on the HCD website. So it is a few week delay, but we will have everything on that website eventually. We do have an extended period of time now for question and answer. So you can either submit your questions through the Q&A box and we'll look at it there. You can also put it in the chat. We have several folks manning the chat looking for questions to pose us. So either way is comfortable with us, whatever works easiest for you. All right, with that, Mary Frances or Alyssa, any parting questions or comments you wanted to say before I jump into question and answer on the next slide?
I am excited to be able to answer some questions. We usually run right to the last minute and don't have an opportunity. So thank you for the questions. Thank you for showing up today. It's always fun to play in California.
All right. So this is going to be a hybrid. I also just saw someone raise their hand. I am willing to unmute folks and let you talk. So I think that was Elena. It popped away. So Elena, hold on for a minute. We have a few questions, but I did see a hand raised, and I don't have a problem allowing folks to speak either. I'm not seeing it anymore, so maybe that went away. If you'd like to speak, go ahead and raise your hand via the chat. I'll go ahead and do that. We weren't expecting so much time, so I want to be extremely flexible. I'll start with the first question I was really tracking. And Mary Frances, this came out of a direct quote that you had early on in the session. You were talking about coordinate entry and really using it for change. And you mentioned eliminating wait lists for shelter. Obviously, California has a lack of services. There might not be enough shelter beds. We have a large unsheltered population in the state. So this seems like a pipe dream for a lot of communities in California. Do you want to just talk about the experience that you had and walk us through a little bit about how you got to that position?
Sure. So I think this was in reference to implementing housing problem solving. So and we've got enough time, so I can give a little deeper context. I'm referring to Arlington County Continuum of Care, which is situated in Northern Virginia, borders Washington, D.C., separated by a bridge, actually two bridges, as well as one of the larger Northern Virginia COCs, Fairfax County, as well as the smaller one, City of Alexandria. So there's a lot of transition between those jurisdictions in the broader metropolitan Washington, D.C. area. In 2014, I was kind of tapped to implement diversion in coordinated entry. We were revising all of our coordinated entry policies. And as a part of that revision, there was diversion as a more emerging strategy at that time. So when I inherited this this position and this opportunity to really put my fingerprint on this model, I inherited a wait list. And the wait list was, this is a smaller-ish community, just prefacing what I'm about to share with you with like, there's no competition when it comes to California. And I fully understand the scope, the size of the challenges that you all are experiencing. But this is scalable and has been scaled in other communities. So I don't want the size of the community that I'm talking about to prevent you or dissuade you from pursuing housing problem solving as a strategy, because I believe in it that much and I've seen what it can do for people that are in crisis. So back to my story, inherited a wait list, a pretty sizable wait list, maybe 30 or 40 families that were waiting for shelter. We had two really small family shelters, and then probably 110 to 120 person wait list for the single adult shelters. So as I'm figuring out what to do with very limited guidance, none from HUD, none from the state that was funding this as a pilot, I started calling people on the list one by one to check in with them, connect them to resources. And I found a theme emerging. Most people that I was calling, they weren't on the streets and they weren't necessarily in need of shelter anymore. They had solved their own problem. And that wasn't true for everyone. What I did through that process was prioritize those that were still in need of shelter at that time based on our triage tool, which we were genuinely using as a triage tool, the VI SPDAT, and was able to clear through that wait list. As we sort of parallel to clearing the wait list and making sure those that were most in need of shelter had access to the shelter, this happened with the rollout of our policies and procedures. That rollout included going low barrier, right? So this wasn't just the housing problem solving alone. We revised our whole system for our single adults, which was where the bulk of our population was. And we did what's called a unified shelter model. I know that some communities in California have started to take this approach because I've worked with the brilliant minds that have done this throughout other systems throughout the country. But when I say a unified shelter approach, we took our high barrier shelter that used to make you, blow on the breathalyzer before you come in, sign out, curfew, all of these stipulations, and we eliminated all of those rules. And what we did was we developed some expectations that were centered around safety. So no rules, no regulations, no requirements, just safety. And that was our focus. We also did an intensive change management process as a part of this implementation, parallel to our housing problem solving strategy. And in that change management process, we were shifting our case management team, and not everyone made it through this transition, from being compliance-oriented case managers to being housing-focused case managers. And what we saw is with the combination of strategies, right? Changing our coordinated entry system from, having folks call individual shelters to doing a centralized access system that involved one single point of entry managed through our Department of Human Services for normal business hours with a shared triage after hour service for night times and weekends. And like we unrolled all of these changes sort of parallel to one another, that led by the housing problem solving or the diversion implementation, helped us decrease our inflow, right? And then increase our outflow. There's not a single strategy that will sort of serve as like the magic mix of how to do this thing. It's being strategic with a set of strategies to reach the goals that you're trying to achieve. And one of those North Star strategies for our community was implementing diversion. The end result was the decrease in inflow, increase in outflow, and we were able to eventually pull some of our shelter beds offline, do some construction, take it completely out of HMIS. And we felt the need that for our frequent users of substance abuse, jail, emergency room, we created a transitional housing program for them so that they could stay and get some intensive behavioral health supports and then transition into housing. And that was not directly inside of our shelter system. We repurposed those county beds and gave them to the behavioral health department because we didn't need that capacity anymore. So I hope that gives you some additional context, and I'm also happy to, be emailed to talk some more about all of the nuances there.
Thanks, Mary Frances. Appreciate that additional context. I'm going to throw this to both of you, and then I have one other question. So again, if you have questions, Q&A box, chat, raise your hand. You got 3 options to talk with us today. There was a conversation, I think this was when you were talking, Mary Frances, but I think everyone, both you and Alyssa can respond to this. You were talking about really making sure that folks with lived experience are being compensated. Can you just speak to that, what that looks like in some of the communities you worked in? One of the threads we saw is, if this is coming out of government funding, that can be really tricky. And we also know that a lot of folks with personal lived experience might have benefits that they get because they're at a certain income. If they get too much compensation, they lose those benefits and it's actually harmful to them. So it is kind of like it's a delicate balance, and it's not a one size fits all for all of your personal lived experience, because they come with nuance as well. So I don't know who wants to take a shot at that first, but go for it.
I'll take it quickly and then kick it over to Alyssa. I think all of those are incredibly valuable points. I have been in your shoes as a government actor that had to convince our accounting and finance team, as well as our compliance team, that yes, in fact, we can pay people and put them on payroll as employees of Arlington County government. And it was a year-long battle, but we did it, and it was worth it, because we then gave people the choice, right? We talked very briefly about participant choice. That goes with payments too. We don't get to dictate to people what happens with their benefits, right? We can make them aware, we can provide informed consent, we can show them what steps they may have to take to manage their assets if they're receiving Social Security, or what their income could look like, and do some modeling. But ultimately, we have to be able to provide compensation, because what if people, just what if, right? What if some people didn't want those benefits and didn't want to have to rely on those benefits in the long term? Also, when it comes to funding, you can use your COC planning grant. I've seen communities not only use their COC planning grant, but work as a continuum to approach private fundraisers or private fundraisers, Lord help me, private funders and foundations, and they're able to secure private, flexible, not as restricted dollars to be able to compensate people more fairly. Alyssa?
That was, I mean, I was going to highlight the philanthropic or private funding as well that has less strings. So that's all I've got to add.
Great. Thank you, Alyssa. Thank you, Mary Frances. And I did say this in the chat as well. We did in a session 2 weeks ago on authentic engagement of personal lived experience. That goes into those topics in much more detail than what we had planned for today with racial equity and coordinated entry. That should be posted on that website that I posted in the chat a few times now in a few weeks. If you want that sooner, you want to see it sooner, we do have a recorded non-508 version. Feel free to email me, and I'll put my email in the chat and we'll get it to you. And I'm going to go ahead and ask the last question that we have before you send more questions in, perhaps. And this is kind of a two-parter. It's really a one-parter, but I got it in two different pieces. So I'm going to do my best to try to merge them together. And I think this was, Alyssa, you were talking about, looking at your local assessment and doing some validity testing. Is it meeting the goal that we set forth? So when benchmarking that, what might be some things that we'd want to do some validation testing around? And if that was Mary Frances, I apologize. I can't remember who said that particular part.
So, well, I love data. I am not a statistician, but I do think that many of the communities that have gone on this endeavor have partnered with, whether it's a local university or even community college that has some kind of research or justice branch that can help support what validation would look like, and what is statistically significant in the data at the local level. I think that would be really helpful. Mary, I don't know if you have any additional context to add, but that's what I've seen communities really rely on and have been successful with.
Yeah, and I briefly referenced Austin, Texas earlier. They have publicly shared not just their tool, but their process. And I think there are some lessons to be learned there. It may not work for every community, but it certainly gives you insights on how they approach doing this work and sort of working towards a more equitable process. So I would encourage you to check out Austin, Texas, and I'll try to find the link.
The second part that I did not do a very good job at all of incorporating was I'm thinking about doing training before and after the assessment design to talk about how as a community you have confidence in that tool. Is it valid or not? Any thoughts on doing that type of process?
I am going to largely defer to Alyssa. even though maybe I shouldn't.
I mean, a couple of communities have done a pilot phase, right? And I think Austin was actually one of them that did a pilot phase of their rollout to do some of this testing around what the old assessment and prioritization process outcomes would have been versus like with the new process, what that looks like going forward. Which does mean that there's a period of time where either you are potentially doing more than one assessment with a given household, or you are figuring out a way to randomly select folks into different assessment processes during that pilot process. And I know that there's a way to do that that ensures that there's still like an equitable approach to that prioritization, even if you are using two different assessment processes during this pilot period, not forever, but during this pilot period. But again, I'm not a statistician, so I can't detail out what that looks like, but there are ways.
Thanks, Alyssa. Last call for questions. I'm going to do just kind of wrap up in my head. We talked about racial equity as it relates to coordinated entry today, but only two pieces of coordinated entry, really the assessment tool and prioritization. You can have a lot of racial equity issues with your access points. You can have a lot of issues with the referral piece of it, the actual, provision of services. So I think those are things that we want to think about in the future. On slide 18, Mary Frances asked if you had any other topics you'd like us to cover. The only topic I saw in the chat was housing problem solving, which I think is a great topic. But if there are other things like access point and racial equity, or referral and provision of service through racial equity, happy to kind of hear those. So feel free to put them in the chat. I did put my email address in there. If you have anything after the fact you'd like to send us, please feel free to do that. Again, I'm going to put another thing in the chat. Again, this is where all the trainings will be posted once they go through 508 compliance. I understand we have a hand raised, so I will ask. There it is. Found it. Teddy, do you have another piece that you'd like to discuss? I've allowed you to unmute. Go ahead, Teddy.
Yeah, hi, not really discuss. I just wanted to clarify that part 2 of that question I had about the assessment testing and validation. I'm just saying that as a future training opportunity that you all provide, it would be interesting to have some California communities be featured with who have used, like a VI-SPDAT or another known tool, and who've iterated, and what their process was like, what started to show up for them. I think that would be an interesting training session going forward.
Thanks, Teddy. And I agree. I think in my experience, I've seen it done a couple different ways. I've seen some communities take the VI-SPDAT and just change it for their purposes. So one of the ones that just pops off the top of my head because it's easy is Las Vegas, who took the VI-SPDAT and thought, some of these questions don't make sense for warm weather. No one's going to get frostbite. They're going to get heat exhaustion. Doing small tweaks like that. I also did a little bit of work in Baltimore where they did the same kind of thing. They took the VI-SPDAT and said, it's 80% there, but we have it. This is what we need for our 20%. We've also seen communities go the other way, which is create their own tool and just say, this is the prioritization that works for our community. I think we're seeing more folks on that side now. But I'd love to hear Melissa, I just merged names, Mary Frances or Alyssa's thoughts on that as we wrap up. No thoughts? Okay. I see no more questions and no more hands raised. So, wait. I see no more questions and no more hands raised. So let's go ahead and close the session early, give you back a half hour of your day. Thank you for attending this California Housing and Community Development training session offered through the Emergency Solutions Grant, Coronavirus Relief Consulting and Staffing Services contract. This session and over a dozen other training sessions will be posted on the California HCU website that you can view at your leisure. Thank you for attending today, and hope to see you in the future. Well.